Hello, everyone. Welcome to Doctors Making a Difference. I'm your host, Dr. Peter Crane. I'm a physician in rural Idaho where I've been in practice since 2011. Over the past couple of years, I've had the opportunity to be both a physician and a patient, and I've been so thankful for the doctors and other healthcare professionals who have helped me. I invite you to join us as we highlight physicians around the world who are making a difference in their communities and with their patients. Our goal is to give physicians and other healthcare professionals the tools they need to be successful in medicine, in finances, and in life. What we do makes a tremendous difference for our patients and our communities. Please go to your podcast service or YouTube channel and give us a 5-star review and hit the like or subscribe button. It helps get the message out to others. You can also check out more content on our website, doctorsmakingadifference.com. Finally, if you would like to be on the show or have any questions or topics that you feel should be addressed on the show, please contact me. The easiest way to get in contact is to subscribe to the newsletter and then hit reply to any of the newsletter emails. Welcome to the Doctors Making a Difference podcast. Today on the show, we have Dr. Eric Glissmeyer. I'm so thankful he's willing to join me. Eric's a pediatric emergency room doctor with some academic background. And I'd love, Eric, if you don't mind introducing yourself to the audience. I think it'd be great for them to hear a little bit about your background.
Well, Peter, thank you. Just a real pleasure to be with you. I think a great deal of you and enjoyed our time back in medical school together.
Thank you.
And think of you as one of the people who was just outstanding, and you're wonderful. So,
Well, likewise, Eric, for sure. Thank you.
thanks. I do practice pediatric emergency medicine in an academic setting at a children's hospital, and my career has taken a lot of turns I never anticipated through worlds of informatics and electronic medical record work, into MBA and things in business. I continue and all the way through have worked ER shifts, all of the undesirables, weekends, holidays, and all of the good stuff.
Yep, that's the joy of ER,
nice,
for sure.
Yeah, no doubt. I had actually someone tell me about, 7 or 8 years ago, like there'll come a day when you really have it doesn't really strike your fancy anymore to, be dealing with this major trauma in the middle of the night, like you might find interesting now. And I'm starting to get that a little bit.
Yep.
Yeah, I've been doing that on faculty at the University of Utah for about 11 years, and kind of a training pathway that went through general pediatrics after medical school and then pediatric emergency medicine fellowship after that. In med school, I thought to myself, I don't think I ever want to be a general surgeon or something. They train too long. And then I went up and did, 6 years of residency
anyway.
plus fellowship and an informatics fellowship and an MBA. So I'm a bit of a glutton for punishment.
Yeah, no doubt. No, but it's pretty cool. Like if you think about, one of the things that a lot of the people who listen to this are doctors in training or residents or early stage attending physicians. And I think it's interesting to talk about because in the early stages of a career, I think it's good for us to look back and say, why did I choose this crazy path? Not only medicine, but how did I get into this particular field? And like you just said, you spent a lot more years in training than you envisioned when you first started. And yet it allows you to do some of the things that you find interesting. And so kind of walk us through that, where, how did young Eric Glissmeyer decide to become a doctor and then be drawn toward pediatrics and then informatics? I think that's interesting to kind of reflect on.
Sure. I don't think that the core motivations for which we start out doing things really ever change. For me, it really started at age 14 when I started to observe people that I knew personally in my life. A church leader who was also someone who was a cardiologist and treated my dear grandmother that I was very close to. Had also treated my grandfather on the other side of the family.
Wow.
Those kind of people, and just seeing how they were kind of able to put on their doctor hat and kind of almost became a different person when they were interacting in a professional way with my loved ones really was interesting to me. And I was amazed at what they could do, what they knew. And I had always loved science and biology and stuff like that when I was young. So those were kind of my initial motivations, feeling like I would love to be able to help people with their problems in that way, as well as, try to contribute to my community and help other people. So those were really the reasons why from the age of 14, I was like, I want to be a physician. And I knew right then. And I worked hard at it. I probably was much more of a nerd in high school than was healthy for me to be. I did some sports, but always felt like I didn't have enough time to, do things my brothers had done, like play on the basketball team, because I needed to study, and I found a lot of fulfillment in studying and learning, and I quit well. It worked out okay.
Well, it's interesting is you talk to people, all of us talk to colleagues and peers, and as I interview people on the podcast, all of us have some sort of origin story, and it usually involves somebody that we observed who was in healthcare who made a tremendous difference for us or for our loved ones. And it sounds like you're no different. And I can relate, Eric. When I was about 14 or 15, my dad said, and we had a family doctor that we liked a lot that helped us and would help people that got in trouble. And he said, "Hey Peter, why don't you become a doctor? Then you can come back to the community and help people." And I was about 14. I'm like, okay. So I never changed my mind. I'm like, okay, I'll do that. And so I just kind of stuck with it, and I found along the way so many mentors and peers, and again made a big difference in my life. That's what the podcast is called, is Doctors Making a Difference, because for sure that's one of it's like you said earlier, the core of why we do what we do doesn't usually change. Even when you get stressed and burned out and life presents different chapters, it still has to come down to that, well, somebody made a difference in my life and I want to give back, or I want to help. And so interesting that you reflect on that. So how was it you decided to go from academic pediatric ER into informatics? I think that's an interesting side journey that most doctors don't get to take, and yet informatics sort of is in the details of our lives. Love it or hate it, it's there all the time. And so I was curious how you entered into that and embraced it.
Fundamentally, I think it relates to my personality tilt, or my kind of color. I'm a very there's a lot of different personality tests, right? Some
Right.
relate to colors. I'm predominantly blue and red, which are kind of people that thrive on both connection as well as competition. So I'm kind of a weird breed. I've got a little bit of both in me.
It's good.
Those are my two dominants. And as I was finishing my Peds Emergency Medicine Fellowship, I knew I wanted to add some additional tools to my toolkit. And what's going to distinguish me beyond just being an excellent clinician. And I had thought I wanted to do like health services research, large data sets, answer big questions related to common problems that we see in pediatric emergency medicine: appendicitis, infants with fever, other kind of major trauma situations. And I started to do some research in those areas and have some success, and thought, well, maybe I really want to learn more about informatics and how to use large data sets and do research with that. So I took some master's level courses at the University of Utah during my fellowship that my division kindly supported me in. And then all of a sudden, I think, serendipity sometimes plays a big factor, right, in
Mm-hmm.
our lives. And I had done residency at a place that used a certain electronic medical record, and I came back to Intermountain and the University of Utah, where at Intermountain at that time they were using some homegrown EHR that really needed to be replaced, and they
I
finally made the
remember because
decision.
I did medical school there, and I'm like, oh boy.
Yeah, yeah. And they finally made a decision. We're not in the business of building an EHR, and we're actually not very good at it, and we should actually buy one. And they chose to buy the one that I was used to. And I was like, oh, what an interesting opportunity. Maybe I can be involved in helping make it a good experience. And that started into me taking these informatics classes I had, one of them, which was implementation of systems, of all things, and turned into me working throughout the 21 at that time, now about 36, Intermountain hospitals, and helping their ERs prepare for and successfully implement the electronic medical record. And we had a lot of success with it. Like, for something that was not a popular thing, and it ended up that the ERs were most happy compared to any other area in Intermountain. And I took a lot of joy in that, because I really enjoy helping my colleagues make things that are painful for them a bit easier for them. That's a big part of what has motivated me throughout my career.
Well, and I'm confident that the message coming from someone who's a peer who is a pediatric ER doctor saying, hey, this is how this works and let me show you how, because I have to work the night shift this weekend. That means a
I'm
lot
right there
more
with you.
than somebody coming in from the outside who works a 9 to 5 job and say like, well, this is how you should do it, even though I've never been an end user. So it's quite a unique gift. And so, I mean, I think it's awesome when you get someone who's actually used it, and all of us get to use EMRs every day, in one form or another. And so having training from someone who's actually done it as a peer who said, I've actually done this for a while, let me show you how, it means so much more. We did an Epic implementation at our facility last year, and that made all the difference. One of our medical school classmates, Eric, was the one that came and helped, and he actually helped us implement that, and it helped so much. I'm like, just have someone who had actually done it, it made a huge difference. So that, even though
100%.
it's a little bit different than clinical medicine, and yet it's a combination of both your clinical skill set and your interest in informatics. And I think if someone was listening to this who maybe have a little of a tilt toward information systems and big data sets and solving those big problems, like you said, here's a career path. Here's an example of a physician who's done that, and I think that's pretty cool.
Well, a neat thing about that is you really can do what you just said, and you can really have a hand in actually making the systems better. Fundamentally, all of us can find plenty of things to complain about in our lives. And you can find ways to improve them too. And it usually is hard. It's usually, most opportunities, as some people say, come dressed up in overalls and look like work.
That's true.
And they're hard, right? It's hard to make things better. It really, the devils are the devil is in those details of really working through things collaboratively, and but you can really make great improvements. And I was at some of the things I most fondly remember as part of that experience, in addition to the people I worked with, were the fact that we were able to tackle some really hard challenges, and we weren't able to make all of them screaming successes, but we were able to make some of them much better, and that's fulfilling.
Oh, that's great. I have mostly interacted with you over the last 10 or so years here, sharing patients that I've sent to the tertiary care center ER for pediatrics, saying, hey, you've got something that needs to be seen in a tertiary care center, because I work in a critical access hospital, and we send there, and then I'll
And
get
you
them
do
in.
an awesome job,
Well, yeah,
Dr.
thank you.
Crane, by the
No,
way.
likewise. And I'll get the note back and be like, oh, it's Dr. Glissmeyer. And I'm so pleased because I know they're getting great care. And so we can't talk about HIPAA compliant type stuff on in a public setting. But I was curious if you have any stories or things that you might share as through your work in pediatric ERs. I mean, sometimes you find people where you make a tremendous difference in their life, and again, you can't share individual details, but in generalities or details of something that couldn't be identified. I'd love it if you could share anything like that.
Oh, you bet. A couple experiences come to mind. Some the very kind of dramatic, and some the more everyday. One that's the more dramatic is I remember when I was working an afternoon, and it was about 4 p.m., and get a phone call from a kind of critical access hospital saying, I've got a child that was mowing the lawn, and something flew out of the lawnmower and struck him in the chest, and we think it's like a nail, and it kind of sucked into his chest, and now we can't see it anymore. And we took an X-ray, and it's like overlying kind of his heart like this, and he's
Holy cow.
doing okay. And we're like, well, can you get one more X-ray view, maybe a lateral? Because we don't really know from this one view. We were able to see the X-ray because they were within our same healthcare system. Um, and uh, and they took the lateral, and then on the lateral, here's your heart, and it was like that. And we're like, okay, it is
Like
in the right ventricle,
penetrating the
right? It
myocardium.
is right in the heart.
Holy cow.
So just even sometimes those little things of caring for kids right before they are going to be able to transfer to you can make some of the greatest difference, because with that knowledge, we were able to have all of the CT surgeons and cardiology and general trauma surgery all in, and they went directly from the elevator to the trauma bay to the OR within, like, I think it was 9 minutes,
So
and
big time
and
savings.
got managed and did great. And it's fun to be able to care for patients that aren't even in front of you yet. That's always an interesting challenge. And having to kind of read between the lines of the information you're getting, and knowing what could be going on and what may need to happen now. is kind of a fun game to play. We actually get to play that game a little bit in a special way now because we've started this process where me and some of the other docs actually work shifts at our transfer center where we sit there and don't have patients in front of us that we're worried about caring for and taking calls. We're just taking calls to try to help serve the docs that are sending patients to us. And that's really fun. And the more mundane things, like I just had a sweet little family the other day in the ER that was sent to us by urgent care because he was having, wheezing, and 2-year-old, and first time he's wheezed and has a cold and is it asthma, and the urgent care just was noticing he was still wheezing and was mildly, he wasn't hypoxemic, but he was close at the time they sent him to us. And we were able to just quickly, honestly, I think he was in the ER less than an hour. We were able to give him a few more puffs of albuterol, make sure his dose of steroid was good, talk with him about follow-ups. And then one thing I've instituted with our primary care group at the University of Utah is a clinic that we peds emergency medicine docs actually work in to help increase sick visit access for the general pediatrics group. And so I was just there yesterday, and I'll be there this afternoon, just working a short afternoon shift to increase the sick visit access. And I had this same patient I saw 3 days ago follow up with me yesterday. So how fun that as an ER doc, I actually got to see them back, not in the ER. And just to have a short conversation with them about like, hey, how's it going? And hey, what should we maybe think about when he gets sick again next? And talk about what to anticipate as next steps, which are sometimes things I just don't really get the time to go into in the ER as much. Or regardless if I have the time or not, the family may not really be able to hear it or process it in the setting of their child being acutely ill. So it's really fun to, I think, at any point in your career, recognize that you can create opportunities to get outside of the normal rut that you ride. And that is always stimulating. Any physician, I think, can kind of experience burnout and fatigue in their job by just doing the same thing all the time and not feeling like they have other opportunities for growth. And you can create those. We physicians have a lot of autonomy, and sometimes more than we remember that we have.
Mm-hmm.
And there's a lot of unique things we can do, and not all of them you do will be successful. I've had to make adaptations in this clinic that we do because we're short on bodies and we can't staff all the days that we used to. And that's okay. Like, you make changes over time. Not everything will stay successful forever. And this is part of our journey.
Yeah, that's pretty neat. I mean, that's a little, that's near and dear to my heart because I'm a rural family doctor. So every time that somebody comes to the ER, like, well, I'll see you in clinic tomorrow, or, I'll be admitting you to the hospital now and caring for you to the end, or, hey, we're going to admit you to the nursing home. You'll be my patient for the next 5 years. And so, and sometimes that creates challenges, but that continuity is a big deal because you're right. In the acute setting, sometimes people are just so stressed by the moment and what's going on. And it's nice to sit down later when the sun's out and everything's good and we're not in as big a hurry. Let's sit down and talk about what we're going to do next time, or how can we prevent this person from having the same emergency again if it's a chronic sort of thing. Or sometimes just to decompress a little bit because they're like, hey, my loved one that I love so much has gone through this thing and I felt like he was going to die. And then you say, well, we did these things and next time we'll be 3 or 4 steps ahead and you'll know when to come in a little better. I think those things make a big difference. You've probably found the same thing I have. Sometimes the biggest difference I feel like you can make is not necessarily that me having the skill set fixed you. Sometimes it's just I provided understanding of what's going on. And we provided a care or did an intervention or gave you a medication or did a surgery that helped. But a lot of times it is saying, okay, I'm here with you in the hard moments. And I can explain what comes next, and I can put it in context, and I can walk that journey with you. And I think that is just as valuable for patients in some regard as getting the actual care. Like both sides of it are important. And I also just want to reflect on, you said the autonomy of as a physician. That is, you have such a gift as a doctor. People don't often. Sometimes I think we get trapped in these mindsets that I can't change or I can't fix whatever it is, and yet you really do. You're the one with the clinical training who's been to the residency, and you've been through all these hours of training, and your administrators or other people who haven't done that just don't have that background, and it gives you a ton of autonomy and a big voice to make a lot of difference. So I appreciate you sharing that stuff, Erica. That's awesome.
Oh, you bet.
So thinking back a little bit on one other comment you said, uh, I thought it was insightful. Is that you're not gonna always love to be in the acute setting at 3 a.m. on a weekend or a holiday, even though the case is interesting. And I remember hearing the same thing. Like you won't always find it fascinating to take on all these interesting, fascinating cases in the middle of the night. Not that they become mundane, but they do become a bit routine because you've seen the same thing again and again, whether it be an emergency or a chronic disease. And yet I still think what we do makes a tremendous difference. And what is routine for us is likely the worst day of somebody's life that for them. And so, how do you find a way to stay engaged and avoid the whole burnout thing, because nobody wants a disengaged, burned out doctor showing up in their time of need? So how do you find that balance in your life?
Yeah, two things for me. The medicine is the easy part, which is hard to understand when you're in training.
For sure.
Because everything is new to you, or if it's not new, you're still trying to kind of figure out where things fit together, and you're really just you know, starting to develop these scripts and macros and how things arrange in your head, and it's all kind of confusing. And then things start to become more familiar, and as you said, a little bit more routine. But that takes time, right? And truly, it surprised me when someone first told me, like, "Oh yeah, the medicine's the easy part of what I do," and it's it's actually very true. I mean, I am always learning, and I make mistakes. I've missed important diagnoses before, and I probably will again in the future, because we all practice in challenging environments. The challenging factors of mine are that I might have 13 patients and families with different needs at the very same time, and not all of them are urgent, but to them they are.
Right.
And learners' needs and different nurse practitioner skill sets and fellows and residents and med students and others that all work with me at the same time, patients that I'm not seeing in front of me that I am caring for, outside our system, as I talked about. So all that stuff can happen at the same time and can be a lot of things to juggle. Um, Yet I do find a sense of fulfillment in it's less exciting to me to get the diagnosis right than it maybe once was years ago, because like that's just kind of like table stakes. Like I can do that. I know that. Um, but when I can like take a frustrated family because they were given unrealistic expectations of what we were going to be able to do for them in the ER that night, like have the MRI machine spun up and ready and waiting for them, and have the gastroenterologist sitting at their bedside when they got there. Those kind of things, right?
Right.
Um, and fix everything, and not charge them for it as well.
True.
All of that. I'm not saying that I'm some sort of like wizard or that I pull Jedi tricks on people. Like these drone. These are not the droids you're looking for. But it is really fulfilling when you can really get down to the core need of what someone has, and as you said, it is probably the worst day of their life, something they're going to remember forever, though I probably won't. Something that they're full of fear, full of uncertainty, and many of us get into kind of a defensive, aggressive, even attacking mindset, right? In posture in those settings. So it's real. And when I can kind of when I can get in those situations, not avoid them, hit them head on, and try to meet the family with genuine compassion and concern for where they're at, and with some realistic expectations and talking with them. It's really fun when you can take someone who is, the nurses are like, oh yeah, you're going to have a problem in this room. This mom, this dad, they're, up in arms, whatever. And we can really kind of make something out of it. That's fulfilling to me when I can have someone feel like we really met them where they're at and help them going forward, even if you weren't able to deliver everything that they maybe came expecting. I still find that fulfilling, and that's a victory for me. And so that's part of what kind of keeps me going, in my job. But I think the other part too is just that I get to work with a lot of other people at different stages of where they're at. These are newer nurse practitioners. These are, you know, fresh out of medical school residents, sometimes medical students. I work in quite a rarefied setting, so it's not maybe one I have the most med students in, but certainly residents, fellows, nurse practitioners, and helping people through their own progress, which is going to be different than mine in their stages of training, is really fulfilling to me and something that is always new
Yeah.
because there's always new learners and they always have their own unique approach and their own unique ways they're coming at things. And I feel like I'm learning new techniques all the time at becoming a better educator, helping them introspect a little bit more and helping myself give more valuable feedback in the moment and things that can help them. One of my favorite things in that sense to kind of help teach trainees when they're in a setting that can be challenging, like the ER, where they made themselves come on shift at 10 p.m. and they're going to be there till, I don't know, 7 a.m. and they're just not maybe super thrilled about being there because who knows just what happened with their significant other or their dog or their, mother back a few states away or whatever, right? That
Right.
day. And they may come into the shift and not infrequently, I'll get a resident seeing a patient and say something like, I'm not really sure why they're here right now. Or maybe say something like, yeah, I'm not really sure why they came to the ER tonight. And often I'll kind of stop them right in the track right there and just say, it doesn't matter. It really doesn't matter. That's not for us to judge or to have to worry about why they came in when maybe you wouldn't because you have more knowledge about fever or about abdominal pain or about, colds or coughs or whatever. And fortunately for me, it helps that I don't get overrun with those things. Working in a center that has a pretty good urgent care network and primary care network around, we've got great colleagues in the community. We don't get clobbered by some of the, just rush of volume of simple things where I work. But sometimes we get our rush, and we almost always get that 10, 11 p.m. rush. And
Yeah, the 11 o'clock rush. Everybody gets it.
yeah,
Everywhere.
and it's good and it's important for all of us to realize, I think, especially in healthcare, which it's a service industry. Like we are serving people, right? That is what we're doing. And in some ways, yes, I do believe that it has a special nobility and a special, as you described, place in the lives and experiences of all of us. Um, and it is a service industry. It's like if I actually like working with people who have physicians and residents who have a customer service background or worked in the hotel industry or worked in something
Yeah.
like that because
Yeah.
sometimes they just get it. They just get it that okay, if they're different than me or have different expectations than me, okay, I can still delight them. I can still help them. I can still try to really make this a positive experience for them. And not all of us have that background. And I think it helps for all of us to realize our judgment probably can just be put on the table and
Right.
doesn't really have a place.
I've found, maybe you found the same thing. I have found that that's one of my key indicators for when Peter is burned out is if I stop caring, if someone is there and I'm just like, oh, I'm just annoyed that person walked in the door and my right eyelid will start twitching. and that's
Well, mine does sometimes, but
Yeah.
usually that's lack of sleep.
Right.
Yeah.
No, I was going to say that's what it is. Usually it's like, okay, I have got to sleep more because I'm usually a pretty patient, kind person, but if somebody comes in and I'm just feeling annoyance and getting the old eyelid twitch, I'm like, all right, I've got to get a full night's sleep somewhere here because I'll come back refreshed. I've got to go on a hike. I probably look like I just went on a run because I just did this morning before the podcast.
You look great.
Thanks, but it's good to get outside and do that. And I suppose all of us have that. We are still very mortal, despite what sometimes our patients seem to expect that everything will just be done in their favor. But as a healthcare, anywhere in the healthcare industry and as physicians in particular, I think the training we've done is valuable to ourselves, but also valuable to society. And we owe it to ourselves and to our patients to keep showing up, not burned out, ready to go, ready to take care of the patient. And I think we'll do better in every regard as on a career arc if we take care of ourselves through the process rather than getting to where you're just burned to a crisp and nothing is fun anymore and you have to like leave medicine, which unfortunately some of our colleagues have done that. And sometimes people even get to the place where they're experiencing suicidal thoughts. And I mean, I don't want to treat that lightly at all. The feelings of burnout and the feelings of depression that people experience associated with a challenging career are very real. They deserve our greatest compassion. And I do think there's some preventative maintenance to be done along the way, because even training, fellowship, and residency is very challenging. And then at the end of that experience, when you are an attending physician, at least in my setting, there's no protections on your time. You know, I could work 100 hours a week and I might get a sympathetic look from some of the other people, but that's it. There's nobody saying, hey, you've worked more than your requisite 80 hours, or hey, you worked more than 30 hours in a row, go home. That does not exist outside of the formal training environment. So it's important to say, I have to take a little bit of time off. I have to have a little bit of time. I can turn my phone off or go on a trip. Or in my case, my favorite thing to go is go outside. I love to hike and camp and backpack. And in the winter, I love to go skiing and snowmobiling. I just love all that stuff. And so I'm curious on your situation, Dr. Glissmeyer. Eric, what have you found to be effective to kind of fill up your batteries when you are drained like that?
Yeah. Outdoors are a big part of it for me as well. Blessed to live like you in a place where mountains are right there.
Right.
And it's easy to get away. I think there's something very renewing and very kind of foundation centering for us when you get in a place where there are non-man-made things a lot bigger than you.
Yeah.
It's always centered me quite well, and I think some people talk about this kind of almost sacred feeling of smallness, and it's very easy to achieve when you're in mountains. You can also achieve that when you're kind of at oceans and escapes like that are large. And I think that's important to sometimes feel small in a healthy way, because a lot of what we were describing and talking about, I think, is burden we carry when we get so wrapped up in our head. And I don't know about you, but sometimes when I really get wrapped up in my own head, I almost start to become a little bit narcissistic, like kind of thinking it's all about me and like everything centers around me or how everything affects me. And, we're as much as we contribute to our communities and to our patients, which we do significantly, we are, in another sense, another member of the community, and everybody else has their own little things going on in their lives. So in addition to that kind of getting outside, it actually really helps me to help my kids on their math homework. Like, seriously, it's like not, I'll be honest, it is not my favorite thing to do.
No, it's hard. The way they do it now, it's like, oh, I got to relearn how to teach
Can we
a
just
math
give
problem.
the kids a textbook? Like,
I know
come
there's
on,
no
anybody
textbook.
else?
Like, all right, I gotta learn how your teacher deconstruct this backward. How are they trying to teach you this thing? Yeah, no doubt that's a different type of problem solving for sure.
Yeah, getting outside of my own challenges and busyness and making sure that I'm attending to the needs of my family are really important. Some people in medicine, I don't fault them for this, but defer, having a family, getting involved with a significant other, if they have a family, having children, really until they feel like, oh, I've made it. And, I think that there's opportunities we get along the way to grow and to center ourselves when we don't defer all of that. And I've been very fortunate to have children ever since in medical school, and have them with me along the way. We took a fun family trip this summer back to Boston, where I did residency, and where my oldest is old enough when we left there to remember some of the parks and things we went
Oh,
to.
that's cool that she remembers that. That's great.
Yeah, it was pretty awesome. And we took a little picture of us in the park, my wife and my child and I, the same way that we did at that point, like 13 years ago. And it was just fun to compare them. So I think being with your family, serving them helps keep me grounded as well.
Yeah, no, it's good advice to talk about, because I think sometimes, especially from the outside perspective, people see doctors maybe in one setting, like, oh, I only see that person at the doctor's office, so they probably only do doctor stuff. And I work in a small community, so every time I go to the grocery store, like, oh, hey, Dr. Crane, you're here. By the way, instead
My
of thinking,
shoulder.
I know, but about my shoulder, I wish it was. I wish it was always something so polite as a shoulder. It's like I got an infection and it's some inconvenient place, and oh dear. But I think people kind of get that idea, like, okay, this is a doctor, and I only ever see the doctor in the doctor's office, so that must be the only thing the doctor does. And when I see the doctor, I think about my health, which is good, but it's also good for us to interact with our families and go to the sporting events and take the kids to help them with math homework, or serve in a community organization or a church or whatever it is, and get involved and just be a real person. And I think it's pretty helpful. It's quite centering to say, like your word, to be centered as you spend time outdoors, spend time with family, make sure you take time to serve the community and not just play one role, because it'll get old. And I wanted to reflect earlier. You said medicine is the easy part, and it is, like, not because medicine is easy, and not because there's, like, it's a career where you're always learning something. It's not as if you have it all figured out. However, it's the dealing with the people and caring for yourself and caring for your peers. That's the stuff that provides meaning and value. It's just so
Yeah.
important to take care of those things that are. I think it's that diagram that shows the things that are urgent, not are urgent, important. We have to do things that are both non-urgent yet so important. Those things that, like, the taking care of family and spending time filling up your cup, and those things are the things that really fill us up for sure.
If we ignore those important things too long and they become urgent, it's often too late,
That's
right?
a good point. Yeah, if they went from
And
the not urgent to now it is urgent that I take care of myself, you're right. That's when generally people are in crisis.
yeah, yeah, with their loved ones, with their significant others, with their children, with their own health, right? And
Yep.
actually, one thing I hope we can talk about, because it's near and dear to my heart as an MBA, that and I've just always had a financial interest in my life. I think one thing you like to talk about, Peter, is financial matters
Yeah,
in
yeah, absolutely. I wanted
training
to
and
bring that
life.
up.
And yeah, I'd love to talk about that a little bit too.
Well, so as part of that, I wanted to lead into that with this discussion that everybody's going to get to their mid 40s and is going to find that, hey, medicine alone is not the thing that's going to fill me up. I have to fill the rest of my life up. And as part of that, the financial side of it is an area where people find great distress in their life. And I shared with you offline before we got connected, and I've shared it with listeners to this program. I had this horrible tumor last year, and it was a really eye-opening experience, because at the time of diagnosis, they were told me it was a 26 centimeter sarcoma, which is usually usually don't live too long with that size of a sarcoma, and it ended up being something that was not a typical sarcoma, and it's gone, and so far has not reoccurred. And I'm so thankful for the medical team that cared for me. I mean, they saved my life, and I'll be forever thankful. But it made me think more deeply about those financial questions, like, would I be financially solvent if I died, in the next couple of years, which heaven forbid. But would my wife and my family be okay? Would my debts be resolved? Would our home be able to be paid off? Do I have enough disability insurance or life insurance, so that if I am the primary breadwinner in my home and that was cut off, would my family be okay? And I think that doctors make a lot of mistakes, especially early after residency or fellowship, because they've had this pent up demand, and you say, like, okay, now it's time to acquire the things of life, a home, a nicer vehicle, a nicer part of town, whatever, and some of the toys or some of the vacations. And yet we are at least 12 years, if not 18 years behind our peers, depending on what career path you chose, because most of the folks have had an opportunity to save and build a wealth, like just kind of general wealth, not income really, but actual wealth where you're saving. And I'm curious what you have thought about that, because I think that there's a lot of wisdom that can come from understanding what that means for people, and what are some practical tips that people could take as they are kind of going through a career arc to avoid financial pitfalls.
You bet. I'd like to share some thoughts I have. I think the underlying principle for me all the way through has been pay yourself first. Now, you don't pay yourself first by buying fancy cars and
Right.
buying an expensive house. That's paying the banker first, and that's paying the car dealership first, right? And it's also not just saving, right? It's also don't put yourself in a circumstance where you're going to, be more likely to have the more expensive, repair bills, right? So, anyways, let me just share a few things I think in that area. You're absolutely right that there's a there's a delayed gratification that we all must endure, right? Going into medicine, it's a long road, right? And it can be hard when you're in your early 20s and you're seeing your buddies getting jobs that are, friends are getting good jobs after just a baccalaureate or not even completing a college degree, right? And you're here slaving it away while you're like trying to get into medical school even, and then when you're in there, you're you're um, you're always thinking about the next step. What about getting into um, uh, what about getting into residency? What about getting into fellowship I want? And what do you even I even want to do? You're always what is the next step? And then those are important considerations and things that will work out with time, but they occupy your thoughts. And all the way along there, many times people are feeling this pent up, like you said, interest in, well, I've always wanted to drive this car. I've always wanted to, live in this kind of place. Um, well, you don't go into medicine for the money, right? In fact, if you
It doesn't
really
work.
are,
Yeah, the
it
math
doesn't,
doesn't work. I
right?
would not recommend it for the money.
And unless you don't believe in the, principle of compounding interest and time value of money, you're right. It just doesn't work.
Right.
That being said, you're gonna be fine. You're gonna make money as a physician. Um, it just is going to be important that you plan. If you are going into medical school and you are, uh, say, going to work in a non-surgical specialty, and you have multiple hundreds of thousands of dollars of debt, you've really got to get serious about a plan, right? To really address this, because you don't want that hanging around your neck for 15 years, right? Or even 10 years. Some people are like, well, maybe if I work in this place, it'll get like wiped away. It might, maybe. And
Right.
maybe laws will change and maybe it won't. I do think it's important, even from the step of where you choose to go to medical school, that you and the choices you make there, the lattes you buy, the vacations you take, the apartment you choose to live in, about what you're racking up in that time. It all starts right then.
That's true.
And then when you do start into a place where you're not actually paying tuition and making a salary, it may be small, pay yourself first, just even a small amount. Now, this may be a small amount toward the minimum required that you have to pay back loans, right? Or it may that you have to your repayment plan, right? But then beyond that, even if it's just starting somewhere, $5 a paycheck, $10 a paycheck, put it away into your retirement in a place you can't touch it. When you are young in your medical career, you can do things that you may not be able to do your whole life, such as contributing to a Roth IRA
Right.
that the government cannot touch, right? And just little bits. You will not miss $5 a paycheck. You can do this. And start small, start somewhere, and you can start doing those things. I think that's really important. You talked about insurance and disability. We do not want to leave our families and loved ones in a place where they cannot pay back the expenses we have to pay. And one of the things that's very difficult to write off is educational debt. So they'll come after your family, and you need to be prepared for that. Whether that's in terms of like, term life insurance is super cheap, right? When you're young.
Right.
Um, and disability insurance, it's actually much more expensive and a harder financial situation to be disabled than it is to be dead.
That's
Um,
true. Oh, unfortunately, that is true.
yeah, so make sure that you look into that. And there's things specific to own occupation disability, where if you don't choose the right kind of disability insurance and you maybe go with the cheapest option, they may say, because of the way the policy is written, well, but you could still work as a you say you go into general surgery. Well, you could still work as a, as a clinic doctor. You should just go into like primary care, and we're not going to pay anything on your policy, even though even though you've lost your right hand and you can't do surgery anymore. Um, make sure that policy is going to keep you in your occupation or pay you, because that might not be any interest to you. If you went into urology and then they say, well, but no, you had a severe concussion and you have, difficulty doing operative cases, but you could do clinic. So we're not going to pay your policy. So be aware of those kind of things. Some people look at the jobs that they get offered when they come out of residency and they're like, hey, this job pays 20% more than this job over here. Make sure you understand kind of your whole compensation package. What are the retirement benefits in the two different ones? What are the insurances, both tail insurance after the fact when you retire, as well as in the occupation? What are the opportunities I have for things you were talking about earlier, Peter, like growth and opportunities to educate and work with learners? Or are you really just going to be maybe looking like you're making a lot of money, but just kind of doing working for someone
Well,
and maybe
right, and
not
they may
really
offer
having
an
opportunities for
employer
growth?
match on your retirement. That's sometimes people will leave that money sitting on the table because they'll say, I'm not going to invest that. But boy, that's a mistake. So if they're going to offer you a 5%, 6% match on what you save in retirement,
Max it out.
quite an important benefit that sometimes gets understated. And yet that's worth tens of thousands of dollars every year if a person will do it, for sure.
And physicians, we are also pretty subject to being scammed by people
Very
because we're
much so.
smart, but we're actually really money stupid a lot of the times
Right.
because many of us have not taken economics and haven't taken finance and haven't taken money classes of other sorts. And one really important thing is as you pay yourself first, set it and forget it. Put your income in reliable, low-cost index funds in the market when you're young, when you've got lots of opportunity to grow. Be aware of where it is. Look at what's called the expense ratio on your investments. If someone's skimming 0.5% every year off your investments, someone's driving a Lamborghini on your behalf. So,
Right.
so be aware of what those expense ratios are and make them, and you low cost index funds are, the way to really build wealth over time. And so that's one thing to really notice of where your
Well, and
money's going.
you have to tailor it. Like I've found with my employer, and they do a good job and they have good fiduciary responsibility. But the plan that defaults was a lot higher index or a lot higher cost. And if I moved all of it to a low cost index fund, but it was one of the options on the plan. But I don't want somebody to come up with a 2045 retirement plan on my behalf because they're taking a bunch of money out of the account in order to set it. But I
That's
think
how the
it
big
makes
firms make their money.
right. So it's a lot wiser for us on the end user side of it to say, I'm going to put it in a low cost index fund with a low expense ratio and let it grow over time. And then if you want to add something more conservative like bonds or municipal funds, you can decide to do that, but you don't need a manager to do that. It's easy to do that within your retirement portfolio, or if you have money you want to invest outside of tax protected assets, you can do so within a backdoor Roth IRA, or you can do it just in a mutual fund, and you have so many options. But like you say, physicians have very little personal education on finance, and it's really important to obtain that so that we're not scammed and so that you have that compound interest over time. And the rule of 72, you've probably seen that one, Eric. You're the MBA, but I just think that's so good for people to understand that on average, it's gonna double if by that rule. If you divide the interest rate, if 72 divided by the interest rate, it's gonna double in that many years. So a 10% interest rate, 7.2 years later, the money has doubled in value. So if you're 35 or 32 when you graduate from residency and you put $100,000 in it, 7 years later, you have $200,000. And then if you added nothing else, 7 years later, you have $400,000. I think it may be oversimplistic, and yet I think I remember at the end of residency, I was not educated about it, and I would have considered myself pretty gullible. And yet, it's important we understand it.
Those were all great points, Peter. And just the way that all trainees, we all pay ourselves first in our education. We put a lot of upfront investment in learning through undergrad and through medical school and making that really apply in residency and a fellowship if you do one. You have to take the same approach in your life with regard to your finances. If you don't pay yourself first, no one could go back and reteach you those things that you didn't, put yourself through the effort to learn in medical school. You have a time to do it. The time is now, and pay yourself first.
Yeah. Well, another principle I've thought of is because you start off, so most people, unless you had the benefit of somebody paying for medical school or you received a tremendous scholarship, most people start off at least $200,000 in debt before you go buy a home. And a lot of times it's much deeper debt than that. And so if a person has the discipline to live conservatively, the mantra could be live like a resident, but even if it's not quite like that, if you say, I'm going to live conservatively, pay myself first. And if you could do that it takes a long time, but at least those first 5 years, it benefits you and sets your financial direction so much better. And then you can start to pay down those debts. You can save up for a home. You can drive a vehicle that's a little bit older. And then when you kind of graduate from that time, you say, well, I've got a plan. I know what I'm going to do. And then it helps out so much. And then when you are in your 40s or 50s and you have all those financial tools in place, it'll grow naturally, and it'll allow you to have all those things, but you can have whatever you want slowly. That's what we say. Our little hospitals, sometimes we can't just go buy the fancy schmancy thing. We can have whatever we want slowly. It's just safe for it. And it's true.
Related to that, Peter, and related to our relationships that we talked about earlier, I think the other thing to remember is one spouse, one house.
I've heard that rule. It makes so much sense.
If you neglect your loved ones, and I have sometimes neglected them to our relationships challenge for a short period of time because of things I've done and ways I've spent more time in learning or work than I really ought to have done, and we've been able to work through those, and we love each other and have great relationships, and I continue to be cautious about that. And if you do not put in the work in your relationships, they'll take it out on you later. Not they, meaning the situation. If you are, there's no quicker way to lose assets than to divorce.
Yeah,
right?
No, it's so expensive for people.
And it's not good for anyone, right? No one goes into it saying, "Oh, yeah, this is going to be this is how I want this to end," right? So I think that beware of those things, and you are on the other side of the relationship. If lawyers get involved, they're going to look at you as the physician and be like, "Oh yeah, we have value to extract here." So take care of your relationships, prioritize them, make them a priority in your life. That's really important.
Yeah. Well, these are all good principles. Pay yourself first. And that doesn't mean buy toys. That means pay off debt, take care of your financial house first. One house, one spouse. I love that rule. We talked about the rule of 72, just the power of compound interest. The earlier you begin to invest that money, the more it'll pay back. And I just think that taking care of those things in that category 2, where things are not urgent yet are so important. We have to do that so that you can show up to work prepared, and so that you can be a good physician, but also just a good human. It makes perfect sense to do that, but we have to be in it for the long haul. Somebody I heard once said that you'll make a lot more money over the course of a career if you work more years than any other factor. And many people burn out and say, okay, I'm so fried, I have got to be out of this by the time I'm 45, 48, and I can never work again in medicine. And unfortunately, that's a great loss to medicine if people do that because of burnout. On the other hand, if you've cared for yourself financially and you've taken care for yourself physically, emotionally, you can keep going for much longer, but you can do it at the speed and the timing of your choosing. And if you're financially solvent, financially independent, financially sovereign, those words, you may choose with your autonomy. You can say, well, I want to work these hours or these kind of shifts or with this kind of patient, and you can find out the things that you are most gifted at, and you can use those things to bless your patients, and it can be like a win-win. You do the best work that you're capable of with your skill set, and your patients receive a doctor who's ready and prepared and able to do it, and your family receives the best person that could be a part of their family. And I think it's important to pay attention to those details because, like you said, Eric, there comes chapters of life where things get imbalanced, and it's a constant process of trying to just re-achieve that balance so that we can do a good job on all those areas.
I found those to be true. And personally, I don't love the word balance because it never really is. I
No,
mean,
it's never
how
balanced.
much of us spend as much time with our children as we do with our patients?
Right.
None
And
of
you're
us,
right.
right?
Balance is, you can never get to a place of homeostasis and balance perfectly. It's hard.
You can't, and I think and that's exactly it. We expect that word means equality, but it isn't, right? Just the way that are you going to become a different person at, whatever you retire, 60, 65, whatever? Are you going to become a different person on that day you retire? No, right? We need to find a way to integrate. I kind of like integration a little bit better. How do I integrate my family and my life, right? How do I integrate my interests and how do I integrate serving my patients with serving my community? And I think that it's a constant battle. There's no magic answer, and that's okay. Just like there's always new challenges each day that in the patients we treat. I think we can embrace that challenge and work with it, but really work to integrate
I
these
love
things in
that.
our life.
Yeah, that's a great way to say it. So you heard it here first. Eric Glissmeyer has given us the key to success: integrate. No, but surely that's a wonderful way to think about it. Integrate all those areas so that you're not just playing one card, so to speak, or one key. You play the whole orchestra of life, and it's pretty important for us to do that. Well, Eric, this has been super enlightening. Do you have any, as we've gone through this, any other thoughts for our audience today? Because I hope that everybody will take something from this interview and feel motivated to either put their financial house in order or become a pediatric ER physician with an MBA, or whatever part of the career you're in. You may find some inspiration and say, hey, this is someone who's made a difference. And I've wanted to have you on this ever since I thought about this. I thought I want to have Dr. Glissmeyer because he's made a tremendous difference in the patients, and not only in the healthcare side, but working in informatics. And I know you do well integrating with your family. And so I really appreciate you taking the time to do it. Any other thoughts for our audience today?
Oh, you're so kind, Peter. Thank you. It's been a delight to be with you. I know that the word sacred sometimes is overused or popularized today, but it really is a sacred space that we get to be in with our patients. You ask them, and years later, they'll be like, well, I just remember that time you sat down with me and worked me through this, or I was really in crisis at this time. And again, you might not remember that because you do it all the time. But it really is a sacred space. And if we can tap into just a little bit of that importance and energy, and be a little thoughtful, at the end of our day, on our drive home, on a walk or a run or whatever you do outside, to think a little bit about from the perspective of those we seek to help and treat. That's really valuable. There was a book written by a Dr. Cliff Cleveland who spent a life in family medicine called Sacred Space that was given to me back when I was in medical school. And it's just a great book and a wonderful read. I'd encourage everyone to look at it.
Oh, great. That's awesome. Sacred Space. I'll put that in the show notes.
Cliff Cleveland.
Cliff Cleveland. Well, no, that is awesome. And so, Eric, I really appreciate you taking the time. I've learned some stuff from this, and I will take those things, incorporate them into my life. And those who are listening, I hope you'll find the same enjoyment. And so, thank you again for taking your time to do this with us today. And I hope that the rest of the day goes great for you.
Yeah, likewise. My pleasure.
Okay.
Thank you.
Thank you so much.